Hi guys, welcome to my channel Learn in Minutes, and today let's learn how to use the Toffel-Mayer retainer and the matrix band. So this is the Toffel-Mayer retainer. If you see, it has an assembly to secure the matrix band, okay, and then you have two screw-like structures. The upper screw is used to increase or decrease the diameter of the band, and the lower screw is used to secure the band into the slot. Now the Toffel-Mayer band is shaped in such a way that when you fold this band, you get a smaller circumference that needs to be faced towards the gingiva, and you get a larger circumference that needs to be towards the occlusal surface of the tooth. So let's try to fit in the band into the retainer. So you keep the slot facing towards your face and your band, the lesser diameter, towards you. You place this band into the groove, and depending on the quadrant you are using, you either turn the band towards the right or towards the left. I will be using it on the third quadrant, so I am turning it towards the right. I will tell you the tip even for that. And once you've secured the band in the first slot and in the second slot, you will tighten the lower screw to secure the band tightly until you feel it's tight. Now it's tight. This is snugly fit into this groove system and won't move. Now, depending on the tooth you're working, either a molar or a premolar, you rotate this clockwise or anti-clockwise. When you rotate it anti-clockwise, it moves, this whole assembly moves up, so the diameter increases. Whereas if you move it clockwise, this whole assembly moves down and the diameter decreases. So we need it for a molar, so I will increase the diameter a little. Okay, and now you need to turn this. Okay, so 2 points that you need to remember is, once when you're placing, the retainer should be facing towards the buccal vestibule, never towards the lingual or the palatal. Second, this groove that you can see here, that needs to be facing towards the vestibule. So in the lower it be facing downward, in the upper it will be facing upward, this groove towards the vestibule. Next, when you place, the smaller circumference needs to be towards the gingiva and the larger circumference will be towards the occlusal third, and you either rotate it clockwise or anti-clockwise to secure it firmly. So this is secured firmly here. Okay, one simple tip that I can tell you is, when you're placing it, if you turn it towards the right, you can use it for two contralateral sides. Here I can use it for the third quadrant and the contralateral upper first quadrant, this way. Okay, and when I turn this matrix band towards the left, I can use it for the fourth quadrant and the contralateral upper second quadrant. Fine. And the only point that you need to remember when you're placing the band is this groove to be facing towards you and the smaller diameter facing towards you. And when you're placing it on the patient, this groove needs to be facing downward and the smaller circumference needs to be facing towards the gingiva. Okay, and you adapt it. So that's all for now, guys. Hope this video was useful and helpful to many. Thank you.